Good afternoon, everyone, and welcome to today's session. Thank you very much for joining us and taking an hour out of your day. My name is Ian Fegley. I'm the Director of Outreach and Engagement here at the Forum for Youth Investment. The Forum is a national nonprofit, nonpartisan action tank that combines thought leadership on youth development, youth policy, cross-system and cross-sector partnerships, and developmental youth practice with on-the-ground training, technical assistance, and supports. Every year, the Forum convenes the Ready by 21 national meeting, which brings together more than 500 national, state, and local leaders who, like you, are committed to improving partnerships, policies, and practices for children and youth. We're really excited to be heading this year to sunny Palm Beach County, Florida, for April 18th to 20th, 2018 for the 7th annual national meeting. Every year, there are dozens of stimulating workshops and sessions from top leaders in education, policymaking, advocacy, and out-of-school time. To share the expertise of these leaders and inform the field of youth development, we launched this free webinar series about a year ago featuring the best content from previous year's events. Today's session is on promoting equity for LGBTQ youth, and will summarize key data and research and provide information and resources, including a blueprint for creating more supportive services and communities for LGBTQ youth. The session is being recorded and will be sent to all of you as soon as it's posted. All lines are muted throughout the session to avoid any background noise, so please submit your questions using the chat feature. Our presenter today is Jeffrey Poirier. Jeffrey is a senior research associate in the Annie E. Casey Foundation's Research, Evaluation, Evidence, and Data Unit. Dr. Poirier works closely with the Foundation's Child Welfare Strategy Group, Jim Casey Youth Opportunities Initiative, and the Juvenile Justice Strategy Group. He serves as a thought partner, conceptualizing and managing research and evaluation investments. He also works on issues related to education and employment opportunities for Opportunity Youth and is co-leading Casey's role in the Adolescent Science Translation Funders Collaborative. Previously, he was at the American Institutes for Research for more than 15 years, where he conducted research and evaluation and synthesized research to develop products for the field. He also delivered training and technical assistance around the U.S. to improve systems, services, and outcomes for LGBTQ youth. It's my pleasure to turn it over to Jeffrey.
Thank you, Ian. Can you hear me?
You sound great.
Great. Well, welcome, everyone. I'm really excited to join you today. And as Ian said in his gracious opening, I'm with the Annie E. Casey Foundation. And here at Casey, we're devoted to making sure that all children in the U.S. have a bright future. And while the work that I'm going to be talking about today aligns with that, it also builds on other streams of work at the foundation, as well as the work that I did prior to coming to Casey at AIR. And I'll be, throughout the webinar, sort of talking about some of the initiatives at Casey and how they align with the conversation this afternoon about equity and inclusion for LGBTQ youth. So thank you again for joining today. And I'm just going to move to the next slide. And really looking forward to discussing with you what you can do to improve opportunity and outcomes for young people who are lesbian, gay, bisexual, transgender, or questioning their sexual orientation or gender identity. And LGBTQ is the acronym I'm going to use this afternoon as shorthand for the population of young people with diverse sexual orientations and gender identities. I realize there are many other aspects of young person's identity when it comes to sexual orientation and gender identity. So I just want to acknowledge that as we get started. And before I highlight the results that you're seeing on your screen today, I'd just like to start by emphasizing that, young people will create tomorrow's prosperity, and that improving their experiences today will lead to better outcomes. And that's really an important perspective from Casey. To do that in a comprehensive way, we really need to think about the range of young people that we serve in systems and programs, whether that be child welfare or juvenile justice or schools or elsewhere, and improving policy and practice for young people who are LGBTQ will foster not only their well-being, but also strengthen our communities. So we also have a moral obligation to respect people as people. A deep moral obligation. So I just want to put that out there as we get started as well. Unfortunately, and I'm going to touch on this momentarily, data and research show that in the case of many young people who are LGBTQ, in particular those of color, there are policies and practices that have kept them disconnected from networks and opportunities that help them to prosper, whether that be engagement with their family, with their communities, with their faith community, with schools, etc. So given this, there really are an asset that is sometimes overlooked and left untapped in the work that we do. However, we need to keep in mind that innovative policies and practices can reconnect young people to opportunity. And in turn, this can strengthen not only the young people themselves, but also their families and their communities. So today I'm really looking forward to sort of diving into this a bit with you, touching on these issues and how you can be a part of this change process and building opportunity for young people who are LGBTQ. And these are the three results that, as I've thought about this webinar, that I'd like to touch on in the limited time that we have together. I do want to cover some basic key concepts related to LGBTQ identity and experience, because we all come to this conversation with different backgrounds and understandings. So some of you may be well versed in it already. I also want you to be able to leave the webinar being able to describe the blueprint of the framework that I'm going to lay out for you in terms of how to improve policy and practice for LGBTQ youth and young adults. And I'm really hoping that you leave with three practices in your pocket, in your mind, that you can immediately apply in your work and share with others to foster safer, more supportive settings for young people who are LGBTQ. So some foundations for today, just to start with that first result I just laid out, is really talking about three aspects of identity that are important to define. And as you see on the screen, it's talking about sex, sexual orientation, and gender. So sex being our biology, and there are different aspects of our biology that define what our sex is, whether that be our chromosomes or genitalia, the reproductive organs inside of ourselves. And often we assume that there's male versus female, that there are two sexes, but really, even just starting here, it's important to acknowledge that there are young people and adults with what we would call intersex characteristics or conditions that may mean that they have partially developed organs that we would scientifically define as male and also scientifically define as female. And so, there's a false assumption that there is an absolute when it comes to how we define sex, and I just want to put that out there, that is not true. Turning to sexual orientation, sexual orientation is I think probably most people understand, is our emotional, physical, romantic attraction to others. And there's a blend there of sort of biology as well as psychological component in terms of how we see ourselves, how we define it, the words that we use, how we express it to others, and a social piece, because really we learn so much in our environment about what it means to be gay or straight or bisexual or something else, and that informs sort of the social piece of this. Third is gender, and that's really a blend again of the psychological, how we see ourselves, as well as sort of some social components. And as you see here, I've laid out really pieces. One is identity. So it's the inner sense of being male, female, or something else. How do you see yourselves? Our expression. So I see myself as male. I express myself as I see in a somewhat masculine way, but I probably do express myself also in ways that are maybe a little more gender non-conforming. Sometimes, going to get a manicure, for example. Some may see that as female expression. Attribution. So how others see and respond to how we look. So those are our assumptions at work. When we see someone on the street, we're scanning our environment, we're immediately making assumptions about someone's gender often based on how they look. And the importance of this is that while we may often be right, we're not always going to be right in terms of how we attribute gender. And for a young person who is transgender or gender diverse, gender expansive, it's going to be really important to that young person that we understand that and that we acknowledge that our assumptions are not always right, and we try to understand that young person. So bringing all this together, think about these three components within the context of our identity. And that identity is obviously more than what's on the screen. It also includes our racial ethnic background, our faith, many other aspects that define who we are. But for the purposes of today, these are three really key components that we need to be thinking about. And real briefly before I move on, I just want to touch on the transgender part of the LGBTQ acronym, which is clearly very relevant to this conversation about gender and sex. So transgender is an umbrella term for someone whose gender identity or expression doesn't fit how we would normally assume someone would be acting. Social expectations for their gender expression based on their assigned sex at birth. We shouldn't use that term unless someone self-identifies in that way. And it's important to acknowledge that a young person may transition to express their gender identity, their authentic sense of identity through various changes. So it could be clothes, it could be their name, their pronoun usage. And there are many ways, there are many terms that young people use to define this. Transgender, we can think about, for example, I've used a few already, such as gender expansive, gender diverse. One that you may hear is gender nonconforming. While that is often used, I tend to prefer not to use it because it suggests that a young person or an adult is sort of not conforming to some rule or expectation for their gender expression, which I think is just leads to false assumptions and a bad narrative about gender. Lastly, before I move on, I just want to sort of highlight too that, as we talk about the experiences and opportunities for young people who are LGBTQ, one barrier historically has been how the mental health community has defined what it means to be gay or what it means to be transgender in mental health terms. And in this case, the good news is that gender dysphoria, which is now used to define the mismatch between body and sense of gender, noting that it's not a mental illness. It's not defined as a mental illness because it's not. Instead, what that does is it acknowledges that mental health challenges associated with someone coming out as trans or transitioning genders are really related to the environment and the stressors that go along with that, and how the environment and that experience in the environment influences their anxiety, their depression, their well-being. We don't have time, obviously, for a discussion. If we were at a training or in the room together, I would really enjoy, having a conversation about these questions in small group or as a large group as well. But two reflection questions I just want you to think about. One is really, what were the key factors that were important and most influenced your development in terms of your gender and your sexual identity? Really thinking back to your childhood and how the behaviors, the attitudes, the expectations of people around you shaped those identities. Thinking about gender when you were a child, expectations around which toys you played or didn't play with, and how you dressed and how you acted. And I've asked these questions in large trainings before, and it's really interesting, some of the responses, because often people reflect on how they were told, girls don't get dirty, boys don't play with those kinds of toys, and how we all receive these messages at a very young age about what it means to be a quote boy versus a quote unquote girl. This is important in the context of this conversation about transgender, gender diverse youth, because they're constantly hearing those messages, and they can reinforce a sense that they're not right and can affect their well-being. And then second, another reflection question is, how often our assumptions about gender and sexual identity influence how systems or programs work with young people? And really here, it's how, as a frontline staff person or an administrator in a program collecting data, or a person working with families, a teacher in a school, how we all make assumptions about the person in front of us, the young person in front of us, in terms of their sexual identity. Hey, Billy, are you bringing a girl to the prom? Who's your girlfriend right now? To, assumptions about gender, the pronouns that we use to refer to you people. So I just want to kind of leave you with those reflection questions. And I'm not going to spend too much more time on terms. I just have 2 more slides, and then we're going to talk about data and research. But real quickly, some key terms to keep in mind that I really want to impress upon you all are shown here. So first is the coming out process, which is really how the process one goes through to accept and understand, accept, internalize their sexual or gender identity, and how we disclose that to others. And a key point here is that it's multidimensional. So, a young person may come out to a teacher or be out in school, and a school may think that young person's doing really well with being gay or lesbian or transgender, but they may leave the school and at home not be out, or not be out with their friends or elsewhere in their community, or vice versa. could be out at home and not at school. So it's really important to think about the multidimensionality of coming out, and that it really is an ongoing and unique process for every young person. So they have to sort of deal with the reality of when and how to disclose who they are to different people in different settings throughout their childhood, if they come out at a young age, through their adolescence. And that constant experience of navigating different settings, whether it be the Boys and Girls Club or their faith-based organization, the church or a synagogue, or what another setting, can create stressors and can sort of inhibit well-being for young people. A few other terms, heterosexism and heteronormativity. Just want to reinforce here that as we think about systems and systemic bias, whether it be racism or in this case heterosexism, there are ways that we stigmatize different identities. Systemic bias and discrimination against non-heterosexuality, non-heterosexual identity is one key consideration. Heteronormativity, how we assume again in systems and organizations that everyone is heterosexual, sometimes, and I'll mention this later, take the form of forms that people complete when they have to indicate their gender or sex, or that, or in this case, that they're parents, that they have a mother and a father, and there's an assumption that it's a household with a female and a male parent. That's a heteronormative kind of approach to collecting data and talking about families. Cisnormativity, so cisgender, I was born male and identify as a man, as male, and so I'm what we would call cisgender, someone who identifies with the gender that they were assigned at birth. So it's kind of thinking the opposite of transgender. So it gives us a language here to talk about what these different populations. And cisnormativity is an assumption that everyone is cisgender, that transgender people don't exist, or that they just don't exist enough to really pay attention. And that's a false narrative that we need to work on. And lastly, and this is a really important one, the role of allies. That as are people who are genuine, have a genuine, strong concern for the well-being of LGBT young people. And it's not just having a concern, it's taking a step forward and really working as individuals and in systems and in communities to ensure that there's the equitable opportunities for young people. And that may mean addressing heterosexism and addressing transgender bias and addressing racism and the tough issues that are social justice issues. So I just want to close here by this part by saying that we can all, no matter what our role is, if we're working with young people, we can all be an ally, and we can all work to improve opportunity and outcomes for young people. And I often talk about how I'm not transgender, but I'm a transgender ally. So I work pretty as much as I can to improve experiences, improve opportunity, improve outcomes for young people or adults who are transgender. So lastly, language to avoid, and then we're going to jump into some of the data and research. But just some highlights here of language you want to avoid. And these are terms to avoid because they're hurtful. Some are also rooted in a history of stigma and discrimination. So for example, you see homosexual on the screen. That has a history of being in the American Psychiatric Association as a mental health diagnosis, as a mental health illness, and that language has often been used to stigmatize the community. Language like lifestyle or choice or sexual preference can reflect a sense that a young person's not being true to their authentic self, that it's not part of who they really are, that it's a hobby, it's a lifestyle, it's something that you choose, it's not really who you are. That's a narrative and language that we really want to avoid because it can create barriers to positive relationships that are really important to building opportunities and positive outcomes for young people. As you see here, I have a sort of a side note about the word queer. The caveat here is that queer is often used by young people to reclaim they have reclaimed it as a positive identity, a sense of going beyond gender and sexual binaries to a much more expansive way of looking at who they are. So as adults, as professionals, we need to be cautious about how and where and why we use that term. Obviously, it's a problem and it should be avoided in a negative context. But I want to also acknowledge that it's increasingly embraced by young people as a positive sense of identity. Transgendered, being transgender as an identity, it's not something that you do to someone. We're not gendered as male or female. We're male or female. That's how we identify, man or woman. And lastly, transvestite, transsexual, and basically, if you're working with young people, these terms I would advise not to use. You can transgender, gender expansive. You've got the right vocabulary, from my perspective, for working with young people, because these other terms have very specific meanings and are just not really relevant to young people today. Okay, so moving on to data and research. I'd like to emphasize how there's a growing body of research and evidence on experiences of young people who are LGBTQ. And I'm not going to go into each of these, but as you can see, there are these experiences and associated stressors that are barriers to opportunity and can lead to negative outcomes. And so these are just some of them, but issues around racism and systemic racism and bias, disparities in the quality of services. So, a frontline provider sees a female young person acting in a masculine way, and they don't like it. So they treat that young person differently because of how they're expressing their gender, whether it be their clothes or the name or pronoun that they're using. In some cases, violence. So we know from research that young people have experienced higher rates of violence because of their identity and expression. And that could be from peers, it could be from family. Loss of connection to culture and community if a young person is thrown out of their home, or if they run away because of fear for their safety. Their father or mother say they're going to kill them if they come out as gay, or if they express their gender in a certain way. How many of us would stay at home as a young person, if we were told that we were going to be beaten or killed because of who we are? Which is why we know from the research that as many as 40% of young people who are homeless are LGBTQ. Those data vary by community and by study, but many studies have shown very, very high rates overrepresentation of young people who are LGBTQ in homeless populations, and this is a key factor contributing to that. So these experiences and the associated stressors that come along with it can influence, a lot of barriers to opportunity again, and negative outcomes, from substance use, so coping with rejection, with abuse, with homelessness. Unemployment, we know that from research that young people who are transgender or gender expansive in their gender expression can have more difficulty getting and maintaining employment. Different issues around sexual behavior, again, running away, homelessness, suicide, and suicide attempts and completion. Based on last research I reviewed, we don't know for certain if young people who are LGBTQ are overrepresented in suicide completions, because those data are often faulty and underreported. What we can say is that we know through data sources such as the Youth Risk Behavior Survey and other studies that young people who are LGBTQ are more likely to consider hurting themselves and to engage in related behaviors. There's growing research showing overrepresentation of young people who are LGBTQ in child welfare and juvenile justice, and I'm going to highlight one of a study that related to some the NE Casey Foundation work that's been recently completed. And lastly, school failure and poor psychological well-being. Lots of research showing that when young people fear for their safety and well-being, that they have poor school outcomes, and also higher rates of anxiety, depression, etc. So I'm going to move quickly in the interest of time. This will be shared after the webinar, and I've also included some links here. The GLSEN, which conducts a survey of students in grades 6 to 12 every couple of years, they're in the process of I think, analyzing and releasing the survey from 2017. These are the data from their last published survey results in 2016. The survey was in 2015. And basically what we see here is that young people reported feeling safe at school because of their sexual orientation and gender expression at high rates. And that those experiences were also associated with issues around physical harassment because of their sexual orientation or gender identity. So really, you can see here how this These experiences create barriers to opportunity when young people don't experience physical and emotional safety in their schools, with 1 in 3 reporting in the survey that they missed at least an entire day of school in the past month, an entire day of school, because they felt unsafe or uncomfortable, and 1 in 10 missing 4 or more days. So these are really a call for action, and from my perspective, a real serious concern as we think about educational outcomes in communities across the country for young people who are LGBTQ, and the importance of positive climate for them. The Family Acceptance Project, which some of you may be well familiar with, is a really important body of work that's been underway for, I think, almost 10 years now, through Caitlin Ryan and the Family Acceptance Project at San Francisco State University. And that landmark research used a range of methods with LGBT young people and their families, such as individual interviews and surveys and case studies, to examine a host of experiences and outcomes for those young people, from their looking at their religious beliefs, their culture, their coming out experiences, family responses to their identity and expression over time, their school-based experiences. And what the data on the screen show is that young people who experienced high levels of family rejection, they were much more likely to experience these negative outcomes or experiences. So, for example, having attempted suicide, 8 times more likely if they were had a high level of family rejection as they were going through their adolescence. So again, this reinforces the significance of family and the importance of supporting families along with young people as we think about the well-being of young people. The last piece of research I'd like to highlight, which I'm really excited about, is going to be published in a special issue of the Child Welfare League of America journal, which is coming out around April. And I'm co-editor of that special issue with Jema Shelton of True Colors Fund and Hunter College. And basically, we've worked with CWLA to produce a special issue on young people with diverse sexual orientations and gender identities and expression who have current or past involvement in child welfare, along with other youth serving systems and services, and homelessness and juvenile justice. We were really intentional in selecting 13 manuscripts that use what we call an intersectional lens. So really looking at the racial, ethnic identity, really looking at other characteristics and not just focusing on, white LGBT young people. And so we're really excited about it. And one of the articles is there in this special issue is one that I co-authored with colleagues here at Casey, as well as Child Trends, who is an evaluator for the Jim Casey Youth Opportunities Initiative. And just to sort of highlight this, for those of you not familiar with it, the Jim Casey Initiative works to ensure that young people transitioning from foster care into adulthood have not only the relationships, but also the resources and the opportunities they need to succeed. And it really works to eliminate inequities that young people of color in particular experience. Within the Jim Casey Initiative, it's what is called the Opportunity Passport Program, and that Opportunity Passport focuses on building financial capability of young people in foster care so that they know how to earn and spend and save as they transition to adulthood. So why am I sharing this? So the Opportunity Passport Program administers a twice annual survey that has been in place for many years with the 17 Jim Casey sites. And that twice annual survey asks a host of questions. Well, in January of last year, we worked on adding items to that survey that collect information on sexual orientation and gender identity of the youth who completed. The journal article will highlight these, the findings in much more detail, but at a very high level, I'll share that what we found was, which is similar to other research coming out, that young people who are LGBTQ were overrepresented in the sample. We found that about 17% of the respondents identified as LGBTQ. The data also show that systems have not achieved the same level of outcomes for participants who are LGBTQ as they have for their peers who are straight and cisgender. And that's true on key areas of the initiative, including permanency, housing stability, financial capability, social capital, and health. And specifically, to share a few findings, we found that young people who were LGBTQ were more likely to experience at least 10 foster care placements, than young people who were straight and cisgender. And youth of color, because we again applied an intersectional lens, so we also looked at not only LGBTQ youth, but LGBTQ youth of color. We found that LGBTQ youth of color reported the highest rates. So that gives us important information on their experiences, the fact that there could be issues of race as well as their sexual orientation or gender identity at play in sort of influencing or at least being associated with these high rates of foster care placements. They were also less likely to have at least one supportive adult who they could call on for advice, more likely to experience homelessness, and also striking, were less likely to report that physical and mental health is at least good. And in fact, the percentage of youth who are white and straight and cisgender rated their mental health as good or excellent at approximately 20 percentage points higher than youth who were LGBTQ. So important findings and data that the initiative is going to use to inform its work. And I hope today gives you a sense of kind of what is emerging in the field as we have an expanded understanding of the scholarship of the, focus on the experiences and outcomes of young people who are LGBTQ. So before I move on to the standards, I just want to wrap up this portion of the discussion by, really emphasizing that, racism and bias associated with sexual orientation and gender identity create barriers of opportunity for LGBTQ young people. And this can occur at the individual level, at the institutional levels, and that, these challenges are not reflective of the fact that there's something wrong with LGBTQ young people. They're not evidence that individual youth who are LGBTQ are inherently less healthy simply because of their sexual orientation or gender identity. And it's also not evidence that these young people lack the ability to develop positive relationships with adults and peers. It's really about the environment and how people respond to and the supports that we as professionals, as providers, that we provide or don't provide, and how families engage with young people as well. So let me just leave you with the two questions to think about. How can we break down opportunities, barriers to opportunity, and how can we ensure equitable opportunities for all young people? So moving on to the blueprint for action, as I call it. I've addressed the first result that I laid out at the beginning of the webinar, and now I'd like to turn to the other two results, which are one, that you leave this afternoon being able to describe a framework, a way of thinking about how to improve policy and practice for LGBTQ in your work, in your communities, and that you have a few practices that you can identify as well, more specifically. So the standards I'm going to talk about come from this volume that I co-edited, I think it was in 2012 now, called Improving Emotional and Behavioral Outcomes for LGBT Youth, a Guide for Professionals. And some of my colleagues at the time wrote this chapter on standards of care. So I just want to acknowledge their work, Simone Gonsolin and Kimberly Helfgott. And what they did is they did a scan of the best practice literature and the current research, and thought a lot about how to approach in a best practice way based on available evidence, improving outcomes for LGBTQ youth. And this work is also guided by 4 principles that were kind of infused throughout this guide. One is that there's shared responsibility across service systems. So this isn't just about what schools need to do or what after school providers need to do or juvenile justice, but it's really about how these systems come together in a system of care approach. There was a strong emphasis on an inclusive culture, organizational culture, not surprising. Also, the engagement of families and having a family-centered approach was really important. And lastly was this notion of promoting positive youth development, that we really need to recognize and capitalize on the strengths of young people and promote their well-being through opportunities, whether it be to foster a positive sense of self, positive and healthy relationships, or to deepen their leadership skills. So you're going to see those principles embedded in throughout the 10 standards. And I also want to acknowledge that, here at the Annie E. Casey Foundation, we talk a lot about and apply to our work results-based accountability, which we call results count, and also racial and ethnic equity inclusion principles and practices. And I think that's especially relevant, both are especially relevant to this conversation this afternoon, as we think about how we can improve outcomes for young people who are LGBTQ, about racial and ethnic equity inclusion, thinking about how we identify the root causes of inequities and how we identify strategies and resources that can target those root causes of inequity. And then also being results driven and being clear about using data to inform the results that drive the work that we do. If you're interested in either of those areas, results-based accountability / results count, or racial ethnic equity inclusion, I encourage you to go to our website, www.aecf.org. So here's the blueprint for action. And I'm going to pause in a couple of slides to check with Ian about any questions or comments coming through after we get through a couple of these standards. But I want to start with a quote from the founder of the Annie E. Casey Foundation, Jim Casey. And he said, and he was one of the founders of UPS. He said that determined people working together can do anything. And I think that's really such a valuable framing of today's conversation, that determined people working together can do anything. And I think that's true for anyone on this webinar that's involved in working with young people in communities, working with families, that if you're determined and you work together with others, we can do anything to improve outcomes for young people who are LGBTQ. So these are the 10 standards. I'm not going to dive into them now because I'm going to talk about each of them individually. So I'm just going to go ahead and start with the first standard. And I'll note too, these are not in any particular order, but in terms of priority. But I will say that I think this first one is a natural first place to begin because we should be data driven. And the first standard is really about conducting a needs or readiness assessment to understand capacity to provide inclusive affirming services, and also to understand the experiences of LGBTQ youth and their families that your system or program or services are trying to reach. The assessment really aims not only at needs, but also strengths. We want to be strengths-based. What are you doing well? What do young people feel is working really well in terms of their ability to access and engage with services and have positive outcomes? You want to be inclusive so that you're aligning individual contributions to this work. So ideally engaging multiple stakeholders in this assessment process. Where possible, infuse this assessment process in other improvement efforts. So I know, for example, in schools where I've done a lot of work, schools have ongoing built-in continuous quality improvement processes, committees. This is an opportunity to infuse that into that existing effort. It's really important to use data, to develop and then monitor your improvement efforts. At Casey, again, referring to the founder said that it had the constructive dissatisfaction philosophy, believing that there are always opportunities to do better by using the lessons of what we do today to inform future ideas. So really using the data and through an improvement process to inform what we do. And as part of the assessment, don't look at LGBTQ youth as a one monolithic population. Think about sexual identities, think about gender identities, think about young people who are questioning their gender or sexual identity. Those are all different populations of youth who may have very different experiences, very different outcomes in your program or system and in your community, and may have very different perspectives on what could work well, what could be better. So it's really important as part of this assessment to try to tease that out. And also building in the racial ethnic lens as well, because as we know, racism alone is a barrier to opportunity. And so we really need to be thinking about that as part of this process. And there are sample questions you could use, which I can share, after the webinar, but really, asking what are the outcomes for young people who are LGBTQ? You may not be able to collect hard data, but maybe there's anecdotal data you can collect from professionals or for young people themselves, and also talking with families where feasible. And really diving into what challenges your organization or system is experienced with trying to reach and serve this population. And again, developing an action plan. So this assessment process, it should not be a form of work avoidance, meaning that people sometimes will meet and create busy work because they don't really want to get to the tough work that needs to follow. And that affects even the best intentioned of us. But this really should be a framing and a springboard for action. And you want to be, again, to align contributions, you want to think about all the stakeholders that need to be at the table, including frontline staff, really thinking about and defining your vision, thinking about the opportunities you want to build for young people who are LGBTQ, the strengths and resilience you want to foster, really diving into the data and looking at the root causes of challenges and inequities affecting the population. And then conceptualizing and defining results that align and will address the disparities or issues that are emerging from your data analyses. And I'll share this with Ian. This is a sample strategic planning tool that I developed when I was in my prior work at AIR. So happy to share this, but was meant to be a tool through some of the technical assistance that I did to help systems and providers sort of frame their goals and their strategies and how they would approach addressing each of the standards. You could develop your own tool or use another tool, but using something that can help frame and communicate about and guide that process is important. The second standard of care focuses on policy, specifically non-discrimination policies. And essentially here, you want to take a look at your organizational policy, non-discrimination policies, and those of any contractors or external service providers that are working with your organization, in particular those that work with young people and families. Do they have inclusive non-discrimination policies? Do the policies specifically mention sexual orientation, gender identity, and gender expression as protected categories, protect from discrimination? This is really important because a lack of protection can open young people and families, as well as staff, up to discrimination, and they lack the protections. There's also research, for example, in schools looking at sort of how more inclusive policies have led to more positive or are associated with more positive school climates. Having the policy, I want to emphasize, is not enough. It's a starting point. So this is not, if you do this, awesome, great. This is not the place where you stop. This is where you get started. You also want to inform youth and families and staff not only of the policy, but also about what to do if they have an experience that they want to report, and how they can do that with confidentiality in a way that doesn't lead to any sort of punishment or repercussion because of their concern. So let me briefly pause there. I'm looking at the clock, and I know we still have a bit to cover, but I'm just wondering, Ian, if there's a key question or comment that you want to share, whether I kind of continue on here.
We've received a few comments. We had a lively discussion in the chat regarding the term two-spirit.
Yes.
Some of the, I don't know if you wanted to address that at all. There were a few people just asking about the term.
Sure. Well, I can't see the chat, but I can say that two-spirit is, it's essentially, to define it, is it has roots in tribal community and culture, and historically are individuals whose have both a blend of gender and sexual orientations that go beyond kind of how we define those in binary terms. And that historically, those were revered individuals. Those were healers and mentors, supports, and for young people and families in their communities. And at the time of colonization, those individuals were often murdered and slaughtered because of their very diverse expression. And so there's been a reclaiming of that identity in tribal communities and culture because of that historical stigmatization that emerged following colonization. So that's essentially, that's another important population to be thinking about, especially as we think about race and ethnicity, that is an identity, that's a really key population to be thinking about, especially if you're in communities with Native American people.
Great. And kind of as a follow-up to that, where do you recommend as a good resource for finding terminology and meaning in this area?
I can share a few. That's a great question too. I can share a resource, Ian. After the webinar, I'll dig some up. I like to start with key terms, but we don't want to get bogged down with terminology either, because we can spend all day talking about terms. But there are lots of resources out there that can go into more detail about language and terms. And so it's great that you're asking, whoever asked is asking about additional background information. So I'll get that to you. We can share that with that strategic planning tool as well.
All right. And the last, kind of getting into, how do you have these kind of conversations? How do you do this? The first question was addressing, the question specifically is, how can I address these types of conversations when some youth are still in their shell? How can I move forward if youth aren't willing to break out of their comfort zone? And then there was a second question that's, the person said they live in a small town and it's not very accepting of differences, so they want to start these conversations, but they anticipate backlash from the town. So kind of how do you, get over those kind of, obstacles?
Sure. Great questions as well. So I think for the question about small towns, I think there are some tools out there that you can access that are about how to communicate and message about these issues and how to reach people that come from a different place of acceptance. And I can try to dig up and share that, but that's really a more nuanced and difficult conversation, but I think it's a really important one that has to be had, because that's the reality in many communities, even larger ones. Because even in a place like Baltimore, where I am right now, there are lots of neighborhoods and communities within Baltimore, and those conversations need to be happening in neighborhood and aren't necessarily Baltimore wide. And so I think there are some tools that I can share with you that can kind of shape that, how you approach that. But it's really trying to meet people where they are. I have found in the work that I've done when trainings, sharing videos where youth talk about their experience, and there are some documentaries such as through GroundSpark, really powerful. I've had people tell me they love them. It really just gets people thinking about the experiences of young people around gender and sexual identity, and helping to sort of break down into from a young person's perspective. The Family Acceptance Project also has videos which are powerful and highlight the experiences of young people and their families. And I think, of film viewing, sort of within the context of a discussion, which is one of the standards later, standard 10 on community outreach, I think can be powerful. Whether or not that's right for your community at this point, there may be, I don't know. You may need to do some groundwork beforehand. But I think as part of a broader sort of outreach effort, you could think strategically about sort of who are the key, who are the people you think that you can influence, and to build their understanding and build their acceptance for this population, sort of support conversations in your community. And I think similarly, going to the first question about how we respond to young people who may not be ready to talk about this. That's also a tough one, but I think, creating safe spaces is really key. And that's going to be one of the standards I talk about momentarily. But, creating spaces where identity is considered, we're creating a safe space where people can talk about and express their identity through different and resources, which I highlight, I think is really key. Just letting young people know that you care, you're a caring adult, you have their interests in mind, and that you're, hey, so-and-so, if you ever want to talk, just about anything, just let me know. Those kinds of cues, just like if we were trying to talk to a young person who didn't want to talk about some other experience or issue in their lives, it's often the same strategies we can think about in this case. Again, we don't want to force young people to have a conversation they're not ready to have, which I know was not your question or your suggestion. But at the same time, we can flag, we can signal to them, we can give them cues that you're a safe, you're a caring adult, you're an ally who's ready if they're ready to have a conversation about this. So let me move on here because I know we have a little over 10 minutes remaining and still have quite a few slides to get through. So standard 3 focuses on workforce development. And the idea here is that, training and professional development is not the end all again of what we need to do, but it's a means to end. And it's one of several, together this blueprint is sort of the more holistic approach. But within that, the idea that we have to develop our frontline providers, we have to develop our administrators and staff and professionals working with young people and families to ensure that they understand some of the issues we're talking about there today. And also how to intervene to address myths and stereotypes and bias that they may see happening in their in the settings where you work. How to signal and cue that you're providing safe spaces and ensuring that those are in fact authentic, safe spaces. Providers should also be, those working with young people should be familiar and able to support young people with the coming out process. That doesn't mean that they're going to have all the answers. And I would say they shouldn't even have to have all the answers unless they're, let's say a mental health provider. What they need to be ready to do is to support the young person as a caring adult and connect them with resources. So being familiar with what resources are in your community for young people who are coming out or who are experiencing a challenge because of their identity. And these are just some more examples again. So making sure that professionals are familiar with some of the data and research that I've already highlighted. Also, we have to engage in a learning process about ourselves. Even those of us who are allies in this work, I mentioned earlier, I'm a transgender ally. I've had to engage in a lot of self-exploration around how I think about people who are transgender or gender diverse and how my own growth around that, going from my assumptions and attitudes as a young person to today, it's a path. And we all have to be willing to engage in that path if we want to become authentic allies. So I just want to put that out there. And in trainings and professional development, we need to engage in tough conversations with people about their assumptions and attitudes. And that isn't just necessarily, it isn't just about sexual orientation and gender identity, it's also about race and racism. Really important in building the workforce that, and this is a standard later on, is doing inventory of resources in the community and sharing that through your workforce development efforts. So this is one tool. This has been adapted from the Dorothy, I think her name was Dorothy Riddle, the Riddle scale, a famous psychologist, I think back in the 80s, who created the scale. And this was, at the time, it was focused on, sort of gay identity, and we've broadened it here to focus on LGBTQ identity and expression. The idea here is that this is a way to think about how our own attitudes towards the community and young people. And really think about this, not, again, breaking down that acronym, thinking about sexual orientation and thinking about gender identity separately, because we may often have different attitudes and experiences for the two. So really thinking across the scale, where do you fall? If you're at acceptance, how do you get to support or admiration? How do we move from tolerance to acceptance? And that's a really important leap, because for many years we've talked about tolerance, and tolerance is really not a place we want to be. Tolerance, who wants to be tolerated, right? We want to be accepted, supported, and admired. We all do as individuals. And so that's important to think about within this context of workforce development and policy and practice to improve opportunity and outcomes for young people who are LGBTQ. And these are group reflection questions I've used before to get people talking. And, of course, inevitably people giggle a little, but it's because there's some nervousness, and it's also because there's some acknowledgement that while the questions sometimes sound silly, that it gets people thinking about, wow, this is the reality. If you're not the norm, if part of the normative culture, if you will, then you don't have to worry about these things if you are. So how have you ever had to defend your heterosexuality to gain acceptance among your peers or colleagues, or your gender identity? Or have you ever worried about that you might be outed as heterosexual? So these are real tough experiences, especially for young people. And And as you can imagine, having to grapple with this on maybe even on a daily basis can lead to concerns that we need, as professionals, we need to be mindful of. So this will be a resource with a few key links that you may want to access. Some are, and this first one to the question about their community, this is a good one. This is focused on schools, but it's also about messaging around sexual orientation and gender identity. So this is a communications and community organizing guide. That's one of the ones I was going to share. So these are all hyperlinked, so they should work by clicking on them when you get the PowerPoint. And there are some other guides and resources here. So moving along, standard 4 is focused on your forms and screening procedures. So looking at your forms, looking at your data collection processes, and as much as possible infusing gender neutral language and asking about pronouns and names used for young people. So yes, you may have to collect data in a certain way to conform to federal or state reporting guidelines, such as asking about sex or official gender. You can still add in other questions about pronouns that young people use. I gave this presentation at a school in Ohio, and a participant from a Catholic school nearby write to me afterwards and share that she went back to her school and they added new questions to their surveys of students and families, changing from mother and father to parent 1 and parent 2, and also adding in fields about pronouns used and the name that they'd like to be used in the school. Confidentiality goes without saying, but I would be remiss if I didn't emphasize that we need to be confidential in how we collect and share data, and being clear with the young people who are providing this information and the families how that information will be shared. And we should never intentionally out a young person, unless there's some requirement because of their physical safety or safety to others. So safe, supportive environments is standard 5. Really important to think about how to foster safe spaces. And there are some examples here that I'm not going to go through individually, but you want to think about safe space signs and about how we behave and how we signal, again, we signal and cue to young people that you're a place of acceptance and support and understanding. The picture here is from a school psychologist that had participated in a training. She said she's an ally and had a rainbow flag in her office to signal that she's an ally. So I asked her to share it with me, and she sent this photo. And here are a few more examples that I've just pulled off the web from different organizations. One is Glisten. The top right one's from the True Colors Fund. And it's really important that, to emphasize here that, a climate of safety and inclusiveness can contribute significantly to creating expectations around respect for ourselves and for others, and really diminishing sort of isolation that young people may experience. So these safe space signs, how we signal that through our behaviors and language, and sort of displaying materials that are LGBTQ inclusive, being attentive to the policies and procedures that we implement, engaging young people on boards to inform these how we create positive climates is really important. So I'm going to skip this discussion. We have another one at the end for those who want to stay on a little longer. Standard 6 is focused on more specifically on what we can do to address bias and really create a more positive space for affirming identity and expression. We want to use the identified pronouns and names that a young person uses for themselves. And we really want to make sure that we build on youth strengths. For youth who are questioning their sexual orientation or gender identity, be an ally. Again, be genuine, support them, talk with them in a respectful way. You don't have to have all the answers, but you should be able to connect them to a resource. So be familiar with what resources are in your organization, in your community. Be sure to respect the process for which they may come out. And also think about other resources that may be outside your community, such as the Trevor Project, with a web nationalization with a website and a web-based community and a call-in line. Those are all resources that you can use to really affirm and support young people. In the case of young people who are transgender or gender diverse, bathroom access and use is an especially important consideration. So having gender-neutral bathrooms that young people can access, irrespective of their gender expression, is really important. There are a lot of instances where young people who are transgender use bathrooms in schools, so they may, or they're told to access a bathroom on the other side of the building, and let's say the nurse's office. If you're in a large high school, you've got 4 minutes to get between classes, what's going to end up happening? You're either not going to go or you're going to be late, and then you've got a behavioral issue. So, it's really important to have gender-neutral bathrooms where feasible, so that young people can access them safely, and don't miss either programming or schooling, and don't end up with health complications that result if a young person does not use the bathroom on a basis. And this is a picture that I took of some gender-neutral bathrooms at a community organization in New York. And it very simply, there's a toilet, which I think is pretty much in essence what we need to focus on, that you don't need a woman in a dress or a man in pants to signal what's behind the door. Standard 7, peer connections. Ian, are we fine if we go on a few more minutes?
Yes, that's no problem at all.
Okay.
And again, if you need to get off at the top of the hour, we are recording today's session, and we will be sending it to everyone along with the slides and resources later this week.
Okay, and I will commit to end at 3:10 sharply. Standard 7, peer connections. Think about how you create opportunities for young people to come together and develop those positive relationships, which are so important in childhood and adolescence. If you're a Boys and Girls Club, if you're an after school program, or if you're in a school, what are ways you can create affirming opportunities for young people to come together with each other? So meeting other LGBTQ young people, and also with peers who are allies. Making sure that young people know where there are affirming recreational activities in the community. So if there is an after-school service that has signaled that it's a safe space, making sure that you're communicating that to young people that you come in contact with who may want to go to that after-school or provider. If you're in a school setting, think about implementing a gay straight alliance or a similar club, which is an opportunity for young people to come together to not only meet others like themselves, but also advocate for themselves and talk about what they're experiencing, and it can be a real important leadership opportunity for those young people. And I've highlighted a few resources here that are hyperlinked. Significantly, Standard 8 is about families. And we would be remiss if we had this conversation this afternoon and talk about the importance of family and how we really need to work with families to improve youth permanency. And part of this is building not only family, but also professional understanding about behaviors that we know negatively affect youth well-being. And again, going back to the work of the Family Acceptance Project and others, some of which are these two resources highlighted here, and others, using those to train, to build the workforce, to build capacity, to improve practice and family engagement. And there are two prongs to this. One is building understanding and minimizing behaviors that are harmful, and then promoting behaviors that are helpful. As you see here are some of the behaviors that, again, come from the Family Acceptance Project that in that research found that were associated with more positive outcomes for LGBTQ young people. And some of these, I say, are a little more straightforward, like, we shouldn't be physically harming our children. Some are a little bit more nuanced. Talking with young people about their identity in an affirming way. Again, acknowledging that you may not have all the answers, you may not fully understand, but that families engage in a conversation in a constructive way. Advocating for their child if they've been mistreated somewhere because of their identity. Requiring that other family members respect their child. Engaging the faith community so that the young person can go to church, go to a mosque, engage in their faith in a supportive way. And then also welcoming young people, their partners, their friends who are LGBT into the home, and just genuinely believing that they can have a positive future. These are just a few of the behaviors that are highlighted in this research that I wanted to sort of share today. So I really encourage you to go to it and take a look at it and go more in depth. And then, behaviors to avoid, which the research also touches on. One key example I'd like to share is, pressuring a young person to act a certain way in terms of their gender. So being more or less masculine or more or less feminine, or, keeping their identity a secret from family, or faith community, or elsewhere. Those could be really harmful. Sort of another component here to think about, we're talking about LGBTQ young people, is the young people who are not LGBTQ, but who have parents who are LGBT, or LGB in this case. So these are data from the Williams Institute. I've included the hyperlink, and they're from the 2010 census. And really what it shows is at the county level, the proportion of same-sex couples raising children. And their analyses of the census data have shown that there are about 650,000 same-sex couples in the US. About 54% of those are female same-sex couples. And that about 3/4 of those are white, 11% Hispanic, and 9% African American. But what this slide shows you is that of those couples, the percentage that are raising children under 18. And the darker blue are those counties that have higher proportions of same-sex couples raising children. So you can see how those counties are interspersed in a lot of areas of the country that are more rural, less populated. And so I encourage you, if you're interested in these data, to go to the website. They have a really nifty tool that you can search by your county and pull up all sorts of data about your county. And you can then use those data to inform conversations that you want to have. Going back to the question earlier about someone in a small community, this could be a form of data that you could use to facilitate a conversation if your county has data in their database. So community services, standard 9, and community outreach, standard 10, before I wrap up. Standard 9 is, you want to think about what are the array of services in your community that are LGBTQ affirming, and really bringing those partners to the table to collaborate and to align your contributions to the results you want to achieve. So it's really important, and that's the sort of the essence of this standard here. Looking at if there are existing resource lists, if not, developing those resource lists of LGBTQ affirming services, whether that be mental health providers, health services, after school supports, just generalized churches that are acknowledged as affirming places. In the work that I've done in communities, this has always been an important step towards their efforts around either systems change or work to improve services for young people who are LGBTQ. And again, broaden your local net. So don't just start with your local resources, but also think about national resources such as the Trevor Project, which I mentioned before, which are no cost to your community and any young person can access. So it's really important to be thinking about that. Again, as you think about aligned contributions, think about partners such as primary care, mental health, anyone engaged in family outreach, and also housing. In addition to what we would maybe typically think of in terms of schools and juvenile justice and child welfare. Lastly, community outreach, and I alluded to this earlier, sort of engaging in community conversations about these tough issues. That's what this standard's about. It's about broadening the net. This isn't just about individual systems and providers, also about the broader community context where those systems and providers exist and function, and where we as professionals work. So consider learning events. Those could be at the organizational level, it could be at the community level. How addressing issues such as how to talk about gender or the importance of supporting young people who are LGBTQ. And if, to the extent you have LGBTQ affirming organizations and community leaders, engage them, bring them to the table. They could be tremendous resources. And of course, include youth and families as part of the planning. It's really important to have that youth and family voice, which I mentioned earlier, as part of this process. And just remember that young people are key to tomorrow's prosperity, which I mentioned at the beginning. So, and all people deserve respect. So begin with these shared values and then explore issues around experiences and solutions in specific ways, specific results that you can work towards to improve the lives of young people who are LGBTQ. So, in closing, I come back to the full blueprint for action. I've covered a lot here, and I'm hoping I'm leaving you with some tidbits to bring back to your work and apply. I hope that you can use the framework to inform some clear results that you want to achieve. And I hope that you do take some specifics back as well related to some of the 10 standards. And I'd also like to say that, improving policy and practice for young people who are LGBTQ will foster not only their well-being, but also strengthen our communities. So I hope that today's webinar has provided some additional information about barriers to opportunity for LGBTQ young people. And as importantly, that I've shared with you some strategies and solutions for improving opportunity and well-being. And just to close, I'd like to share a quote again from our founder here at Annie Casey Foundation, Jim Casey. Our horizon is as distant as our mind's eye wishes it to be. Our horizon is as distant as our mind's eye wishes it to be. And I hope that we all have a very long horizon in thinking about sort of what we need to do to improve results, but that we can get there. And that we can all be part of that change process. So thank you for joining today, and I'm happy to answer a few more questions for those who'd like to stay on the webinar.
All right, well, thank you very much, Jeffrey, for your time today. This has, really sparked a huge conversation on the chat and has even sparked conversations within our office, just, talking about equity and really, there's a team of our staff actually having a brown bag upstairs right now and kind of discussing at the conclusion of today are going to be discussing these issues. So it's really kind of sparked a lot of ideas and a lot of insights, both on the virtually on the chat and in person here. A few questions that have come in. One would be, what is your recommended age to start asking youth and talking to youth about their gender identity or sexual orientation?
Well, sexual orientation is a little tougher, but let me start with gender identity. There are some good resources. I mean, I think it depends on the context as well, but let me focus on schools, which is one I'm really familiar with. The Human Rights Campaign Foundation, through their Welcoming Schools project, has several resources that you can access and that focus on how to talk about gender and identity in age-appropriate ways. And that includes in elementary schools, using books that really get at differences of gender and different sort of family units, sort of that are age-appropriate. There are a whole host of strategies you can think about to sort of begin to have those conversations with young people. And they also have resources for the middle and high school grades as well.
Great. Another question that came in was somebody who's, planning a number of events for LGBTQ youth. Their question was, do you think it's best to include LGBTQ youth into youth community programming, or is it better to have separate groups or safe spaces?
Well, what I would go back to a sort of a principle of practice on the answer to this one, which is engaging young people and youth voice in how you make that decision. I think it's really key to talk with those young people about what it is that they feel they want and need and would most benefit and why. I don't think there's necessarily a right answer in this case. I think a lot of it's going to come back to what the young people feel is in their best interest.
Another question. Oh, go ahead.
No, I was just going to quickly mention too, Ian, that these are the kinds of decisions and discussions that we all need to be having. Sometimes there isn't a right answer, but there are trade-offs to different approaches we can think about. And I think in this, there really are trade-offs to both approach, having separate services and programming versus more integrated services and programming. One can make the case that, having it separate isolates them. It prevents them from engaging with their peers who aren't LGBTQ and building some of the relationships that are important there. On the other hand, you can make the case that having it separate is really important because of the behavior of their peers, or because they need to have conversations and about tough issues that their peers maybe not want to engage in. So I really think, again, it goes
Mhm.
back to talking with the young people about their needs.
And I think this is, in that same vein of probably needing to have conversations. Someone was asking, they're working on supporting gender expansive youth in programming that involves housing that has traditionally been split by gender. They don't want to make those gender expansive youth feel unseen by making them choose between male and female, but also don't want them to feel separated by picking a new space.
Right. Yeah, and there's some, there are definitely guidelines and practice recommendations around housing for out-of-home care as well that are out there and that I could share.
Okay. And one more question that came in early on. Have you done any work with LGBTQ youth and disability? We do a lot of work with young adults with disabilities and see increasing amounts of those young adults who are thinking about and questioning their sexuality.
That's another great question. I haven't personally. It's been in conversation in past work I've done in trainings and in communities that about how best to support young people with disabilities, with mental health challenges in an age-appropriate way. And there, again, I think there are some resources out there that we can share.
I think that summarize the main questions that come in. I want to thank you very much. This has been a wonderful conversation, really informational for me. And it's the largest one I think we've had so far. I think there were about 320 people on the line today. So yeah, thank you very much to everyone for spending some time with us this afternoon. We definitely want to encourage you to stay engaged with upcoming opportunities at the Forum for Youth Investment. Please sign up for our newsletter. It's easy to access both via readyby21.org and forumfyi.org. The next session that we'll be offering will be on February 22nd, and will feature a conversation between the Forum CEO, Karen Pittman, and Keith Hefner, who's the Executive Director of Youth Communication. They're going to be discussing some powerful resources that are now available that are helping teens who have experienced trauma in their lives. So please sign up for those and stay in touch. And again, Jeffrey, thank you very much for your time today. We really appreciate it.
Sure. Thank you, Ian, and thanks to everyone for joining, and look forward to connecting in the near future.
All right.
Take care.
Well, have a wonderful afternoon, everyone.